Hi, everyone. I'm Dr. Pizano, and today we're going to be talking about nutrient testing and dietary assessment. We're going to look at various types of tests, the different biomarkers, and even a little bit about how to advocate for ourselves. So, the first thing that I really want to discuss with you are the different types of labs that are actually available. The ones that you're probably most familiar with are the traditional labs that your primary care doctor, as well as specialists, order things like a complete blood count, comprehensive metabolic profile, lipid panels, iron, vitamin D, etc. And these are always a great starting point to really see where you are nutritionally. We also have more advanced testing, things like genetics and genomics. Of course, we have medical genetics. If you were screened for various types of connective tissue disease, you might have had medical genetics run for that. There's nutritional genomics, and then there's all the ancestry testing companies like 23andMe, for example. Metabolomics, you might not be as familiar with. This is really, we're going to talk about this in more detail, but they're tests including organic acids, amino acids, fatty acids, red blood cell mineral testing. And it's a great way to assess the biochemistry and how your nutrition is impacting that. We also have microbiome testing, things like stool testing, as well as things that might help if you're having sinus issues, like sinus swab cultures. Not something great in terms of nutritional status, but certainly helpful. And you can also culture other types of tissues as well. There are some other tests that I would say probably are not nearly as robust in their evidence, things like white blood cell, nutrient testing, hair analysis, and food intolerance testing. In terms of those traditional labs, these are going to be typically ordered by your primary care doctors or specialists that you see. You also, depending on where you live, nurse practitioners and other providers may be able to order them as well. When we think about these traditional labs, they're best for looking at chronic deficiency states, meaning if you have full-blown iron deficiency anemia, or if you are vitamin B12 deficient, rather than insufficiency states. They're not great at finding exactly, how much more you might need to have optimal levels. And that's because a lot of these markers are looking at the level in the blood, and the blood itself is water soluble, and so are many vitamins. And so it's a wonderful way, though, to look at fat soluble vitamins. Vitamin A, D, E, and K are fat soluble. So we just need to know that we're looking at the right lab for what we're looking to assess for an individual. So if we think about our vitamins, the water soluble ones are going to be vitamin B1 or thiamine, B2, riboflavin, B3, niacin, B5, which is pantothenic acid, B6, folate, B12, biotin, and vitamin C. What happens with these water soluble vitamins is that when you eat food or have a supplement that may have extra vitamins in it. And that doesn't necessarily mean, you're taking a multivitamin or something like that. It could be a fortified cereal, or if you're drinking a nutritional drink that has some extra nutrition in it, it can actually elevate the levels in the blood, and they stay elevated for a period of time, not that long, but a period of time. And so it's really sensitive to what you're taking in and not necessarily showing what your stores are looking like. Additionally, some of these markers, B6 in particular, the levels shift with chronic disease and inflammation. And so elevated vitamin B6 isn't really associated with nutritional status very closely. Certainly, though, if you were to find low levels in the blood of these various vitamins, that would show deficiency state. So wonderful for assessing true deficiencies. And so it's never a bad idea to check that box, particularly if you're having difficulty meeting your own nutritional needs or having malabsorption issues. Minerals are a very different kind of thing to assess in terms of traditional labs, because so many of these are very important in things like how our heart is going to be able to function. We tightly control them in the blood, and that is a process we call homeostasis, where the body is trying to keep everything in balance. Since many minerals are actually stored in bone, the body will actually break down bone and bring some of these minerals back into the bloodstream as needed. That means it can be difficult to get a real read on things like calcium and magnesium, sodium, chloride, potassium. There's that tendency to stabilize the body that allows for us to have very normal levels unless we're very depleted. So again, great way to assess long-term deficiency status, not a great way to see whether you're truly getting enough in the diet. However, for some of our trace minerals, it can be a better way to assess. So things like iron, zinc, copper, selenium, chromium, iodine, manganese, and molybdenum. Iron in particular, we have a great iron store marker, ferritin, that can be used, commonly ordered by most primary care doctors and many specialists, especially hematologists. Right. Let's talk a little bit about genetics and genomics, which is clearly a little bit more complicated testing. We really need to have people ordering the testing that are qualified to read these tests. So there's a lot that's available direct to consumer now, even whole genome. But the question is, do you or do your providers know how to use that data set? And so I want to make sure that you're really thinking about that when you go to order it, because there's nothing more frustrating than having really great testing done and then nobody can help you with the interpretation. So medical genetics is going to be the gold standard if we're actually looking for genetic diseases. When we sequence data in genetics, it has to be done many times to get a very accurate read. So medical genetic testing is typically done at 30 times sequencing so that it doesn't have as higher risk for errors. We want to make sure that the labs that are doing this have appropriate credentials. For example, in the United States, it's CLIA certification, and other countries, they have other kinds of certifications they do to make sure that the lab test results are actually accurate. Typically, medical genetics are going to be ordered by a geneticist or another medical doctor specialist. An example of this, of course, is a connective tissue disease panel, but we can use this as far as doing whole exome or whole genome if they're really trying to figure out something in an individual where they're not really sure what might be causing the troubles. Nutritional genomics, on the other hand, is a great way to look at personalized nutrition needs. And this is becoming increasingly popular. It's a great way to figure out how to handle things like hypertension, high cholesterol, lactose intolerance, maybe your individualized vitamin needs. People can order this with various backgrounds. It depends on the country, certainly medical doctors, and more typically nutrition professionals. We also have ancestry testing. I'm not going to spend a lot of time on this, but I do want to let you know that this is single pass technology and therefore is not particularly accurate. It's wonderful for finding out your personal heritage, but it's not appropriate at all for medical genetics or nutritional genomics. All right, metabolomics, one of my favorite areas. So metabolomics is really looking at all of the measurable aspects of the biochemistry in your body. We're looking at metabolites that are created in the various biochemical pathways. And the reason this is helpful is because pathways have enzymes, which typically are going to have vitamin and mineral cofactors. So it's a great way to assess how much you might need more of a particular micronutrient. It will tell you if you have a true deficiency, but now we can also start to see when we're not quite meeting our needs so that we can either work on shifting diet or adding in supplementation if needs are much more extreme. I do want to take a moment and look at this little picture that I've included here for you. I don't expect everybody to have a strong biochemistry background, but this is a very simplistic pathway that I have here where we have a particular substrate moving in. We have an enzyme that requires a cofactor, and then it becomes the product, which would be B. When we don't have enough cofactor, we end up with this little blockage here, and that's what organic acids are. So they're coming in through here. Amino acids, which are building blocks of protein, help make up our enzyme, which is a type of protein. And it's probably it can also be some of these substrates and products as well. So really a great way to get a better idea of overall, are you meeting your needs sufficiently? Microbiome, of course, has been a huge area of research and interest for quite some time. This is the sum of all of the microbes that live synergistically on and in our bodies. It's not just referring to the microbiome in the gut. So we can also have measurements for skin in the oral cavity, vaginal, etc. So the most common assessment here is stool testing. This can be great for looking at the balance of the flora, if there are bacterial or fungal overgrowths, need for additional prebiotic fibers. Pancreatic elastase can be measured with this, which is a sign of whether you produce enough digestive enzymes. It's medically used to diagnose pancreatic exocrine insufficiency. We can look at allergy through eosinophil protein X, and then inflammatory bowel disease will cause elevations of another marker called calprotectin. I will caution you that while we can get a good idea of infections and overall balance of the microbiome, we don't really have an ideal microbiome that we're working towards at this time. There's so much fluctuation and change, even day to day, based on what your diet looks like and other parts of lifestyle and environment. So now, how do we figure out what to order? I mean, clearly, I just discussed many types of tests, and we may or may not have easy access depending on where you live. But how can we figure out whether something's useful or not for someone? So the first thing to consider is whether it is ordered by a doctor or other medical provider, or you're ordering it directly as a consumer. I caution against direct-to-consumer testing. It can be very challenging if you do get results, finding somebody who can actually interpret them for you. And you also may not be qualified to make that call as to whether something is actually the right test for you, as well as whether that test has enough validity. We also need to make sure that we think about specificity, meaning will the test actually look at what we want to evaluate? So for example, if I want to know whether I actually have truly sufficient levels of riboflavin, I don't think I'm necessarily deficient, then riboflavin is probably not the right way to go. And something like organic acids might be more appropriate. Do we have a provider that can interpret? That becomes very important. And then do you have a way of executing changes based on the results, right? So if you think that the only way to fix something is something that you can't tolerate, perhaps adding more foods or adding in supplements, then that's probably not a great test because it's going to be frustrating because you won't be able to do very much with the results. I do want to talk for a moment about food and sensitivity and allergy testing. This is an area that a lot of people gravitate to because they think it's an easy way to figure out how to make reactions stop. The challenge is there's not a lot of credibility in IgG food testing. That's because your IgG levels vary based on how much you eat of a particular food. The more you eat of a food, the higher the IgG status is, but that doesn't necessarily mean that you're having a negative response to that food. And if you don't eat a food for 6 months, you typically will no longer make the IG towards it. And so what happens is people start making eliminations and running these regularly, and it becomes a very narrow diet, which is not very healthy. In terms of IgE allergy testing, that only looks at one aspect of the allergic response, and it's not typically what most allergists and immunologists do to assess allergies. They would typically do the skin testing. Difficult to do, of course, with EDS patients because of dermatographism, or what we call skin writing. We get a raised red welt that forms with scratching. But in terms of food sensitivities and allergies, that's going to be looked at a little bit further today in session 3. So that'll be covered in much more detail there. So what kinds of tests should you actually get for yourself or ask for? One, if you're looking for true deficiency states, you're exhausted, you look pale, you think you're anemic, traditional labs are going to be best to look at that. And typically that will be ordered by a primary care doctor. And you might want to look at something like a complete blood count. Certainly, for other needs, it might be a comprehensive metabolic panel, iron panel, ferritin level, vitamin D, et cetera. These are when we think we really have a deficiency, that's where you want to go. If you're wanting to make sure you're meeting all of your nutritional needs, that's where metabolomics comes in. And we want to work with a nutrition provider with experience interpreting these organic acids, amino acids, fatty acids, etc. So that's a great way if you're looking to make sure you're optimizing your diet and how your diet actually is impacting your health. That's where I would go. Now, if you're having severe GI symptoms, that's when we might want to see a gastroenterologist who could order diagnostic testing. Less severe, maybe some bloating and constipation or a little, mild occasional diarrhea. You're worried more about what we call dysbiosis or imbalances in the microbiome, more stool testing that would be ordered either by a nutrition provider or other kinds of doctors that are interested in that might be much more appropriate. Some of that discomfort here, I have that actually here, the stool testing. SIBO testing also might be something to look at. And again, that's something your primary care or gastroenterologist can order as well. Sometimes nutrition providers will also be able to order that. If you want to meet all of your needs, that's again metabolomics ordered by nutrition provider. But I do want to mention that you don't always have to do expensive testing. You can do things like food journaling or tracking softwares where you can calculate how much you're taking in of these vitamins and minerals, as well as your carbohydrates, proteins, and fats. Now, how comes the hard part? How can I advocate for testing? So the first thing is you want to find the right kind of doctor for what you want to have assessed, right? If you go into your primary care provider and ask them to run metabolomics testing, it's not something they typically have a lot of training in, and they're not really going to be comfortable with that. But they can do basic nutrition. So if you feel like you have iron deficiency, anemia, B12 deficiency, vitamin D, usually they're quite happy to assess that for you. If it's much more severe, they might refer you to a hematologist, and that's appropriate as well. If you have malabsorption and severe GI issues, you want to go to a gastroenterologist. If you're having a lot of food allergy kinds of symptoms, you want to go to immunologist. And if you're looking for more specific nutrient testing to make sure you're meeting all of your needs or ways to get to meeting all of your needs, you want to see a nutrition professional, someone that is either an RD or CNS. In terms of assessing the diet without laboratory testing, we can get a lot from this. Helen Spriggs is actually going to be covering that in much more detail at the end of the session. But there are lots of great low-tech and high-tech options. So food journaling, and there are lots of books that have the dietary values if that's more comfortable. And there are great applications and smartphone apps and for tablets as well as web-based programs. If we're going to look at our diet, this really sometimes can get a better idea over time of what we're taking in, as well as how much we're taking in terms of calories, whether we're getting enough proteins, carbohydrates, fats, or too much of a particular nutrient. This can be done on your own if you feel confident assessing your needs, or you can do this with a nutrition professional. This is really much more of a personal option for you. Some people really kind of want to dig into things and kind of work, and some really need a little bit more help. A lot of times this depends on how much you're able to tolerate. For many patients, they have a lot of intolerances, and some support from somebody with nutrition background can be quite helpful. And so that's going to bring us to the end of our talk. I really hope that this is helpful in terms of figuring out the best ways to look at your own nutrition, as well as who to ask for help for. It can be challenging advocating, but usually if you go into the right type of provider for that question with a very specific need, they're much better equipped to help. So plan out the appointment, maybe even write a little agenda that you can share with the provider, because time is often limited. So they know what your biggest goals are for being able to accomplish what you need in that particular appointment. I hope you've enjoyed the presentation, and if you have any questions, I'm certainly happy to answer them when we have our Q&A. Thank you.